This is the lecture over multiple sclerosis, chapter 37. So what is happening in the body? MS is a progressive autoimmune disease. It's a chronic disorder of the central nervous system where the myelin sheath and nerve axons in the brain and spinal cord are destroyed. The body attacks the myelin sheath and nerve fibers in the brain and spinal cord, leaving lesions. Signals cannot be transferred where it needs to go. Axon is inflamed and scarred, leading to a deficit in motor and sensory function. There are four types of MS. Relapsing and remitting is the most common. New symptoms develop and then resolve, and the patient returns to a baseline. It can progress to secondary progressive. Primary progressive is gradual, steady deterioration with no remission, and there's no acute attacks. Secondary progressive begins with relapsing, remitting, that progresses, and then progressive relapsing is the least common. It's frequent relapses with partial recovery, and they do not return to baseline. So in your assessment findings, the clinical manifestations of multiple sclerosis are very broad and related to the lesions found in the client's central nervous system. The severity and range of manifestations are due to the number of lesions, their location, and the amount of tissue damage. Manifestations from relapses often resolve, but over time, residual manifestations begin to accrue. So emotion and cognitive, the patient will be drained, depressed, speech issues and swallowing issues, mood swings, and trouble thinking. In sensation and motor, you may note tremors, spasm, clumsiness, numbness and tingling, dizzy, and coordination impaired. With vision changes, you'll see double vision, blurry vision, nystagmus, dull gray vision, pain-moving eyes, and dark spots in their vision. With elimination, they cannot hold their urine, or they'll develop nocturia, an overactive bladder, bladder retention, or constipation and diarrhea. Chronic neuropathic pain is experienced nearly daily, and it's unpredictable. Illness, fatigue, and overheating can increase the risk of this type of pain. Musculoskeletal pain is also a manifestation of MS-related weakness, coordination problems, and stiffness. Often is caused by compensating for changes in gait, and falls can also cause musculoskeletal pain. Spasticity is also caused by MS and is described as stiffness or tightness in muscles. Some key features of multiple sclerosis can be found on page 916 in your book, box 37.1. There are no specific manifestations or lab tests that lead to a client being diagnosed with MS. Other medical conditions must be ruled out. A lumbar puncture to assess the cerebral spinal fluid will show elevated protein and WBCs in the CSF fluid. MRI reveals plaques, documents disease activity, and evaluates treatment effectiveness. An MRI is the preferred imaging method to assist in diagnosing MS and monitoring the course of the disease progression. Medication therapy is aimed at modifying the disease, so decreasing the inflammation and suppressing the immune system, so there's an increased risk of infection. It's also aimed at treating acute episodes or relapses and treating symptoms. Disease-modifying medications decrease the frequency and severity of relapses, reduce brain lesions, increase future functional capability, and the overall quality of life. There are two main groups of disease-modifying medications: immunomodulators and immunosuppressants. Natalizumab, a humanized monoclonal antibody, can cause many adverse events, including opportunistic viral infection of the brain that can lead to death or severe disability. You want to monitor for neurologic changes, especially changes in their mental state, such as disorientation or acute confusion. Natalizumab can also damage hepatic cells. so carefully monitor liver enzymes. Mitoxantrone is a chemotherapy drug. It's been shown to be effective in reducing neurologic disability. Fingolimod was first immunomodulator approved for MS. It can be taken with or without food, and patients must monitor their pulse because the side effect is bradycardia. And laboratory monitoring of the WBC count because the oral drugs can cause a decrease in WBCs, which can predispose the patient to infection. With some other drugs like interferon and glatiramer acetate, they may develop flu-like symptoms, and they're at an increased risk for infection. Stem cell therapy is being researched as a promising treatment to manage MS, and this therapy may slow the progression of the disease and decrease symptoms. Nursing interventions and treatments. We want to maintain optimal mobility and function as a result of managing fatigue and pain. Some pharmacological ways we can do that is to treat the symptoms of spasticity, tremor, and pain with baclofen, tizanidine, diazepam, or propranolol. Paresthesia may be treated with carbamazepine or tricyclic antidepressants. Corticosteroids are used to decrease inflammation. Isoniazid is an antibiotic that's used to treat tuberculosis, but has been shown to help with certain tremors in MS. Non-pharmacological clients who have MS may need a variety of mobility and accessibility aids to increase their quality of life. Assistance animals are also available to help with guiding clients, turning on lights or off lights, pulling wheelchairs, retrieving items, alerting them to sounds, and providing balance support. Also, vehicles can be adapted for clients who have MS. Occupational therapists can assist with assessing the client's needs and recommending adaptations, and physical therapists can assist clients who have MS with walking and mobility, their posture, strength, balance, fatigue, and pain. Treatment includes exercise programs, mobility aids, and gait training. Nurses must discuss lifestyle and behavior modifications, including energy management, to avoid deconditioning and disuse with weakness. Shoes should be lightweight and supportive, have a cushioned insole and arch support, and enclose the entire foot. Rubber soles can add stability. Ambulation tools are available to assist with mobility issues. The most commonly used include foot drop braces, forearm crutches, folding canes, and four-wheeled rolling walkers. The client may need multiple ambulation aids. We also want to maintain optimal bowel and urinary function. Bladder dysfunction due to blocked signals to the bladder and urinary sphincter. Manifestations of this include urinary urgency, frequency, urine leakage, and night urination. So the nurse should encourage adequate hydration. They must educate the client to limit caffeinated beverages, alcohol, and smoking. Self-catheterization can be used for clients who have bladder retention, and nurses must educate clients on this procedure when indicated. Oxybutyn, butylene for overactive bladder, and bathinical to aid in bladder emptying. Bowel dysfunction is a common manifestation of MS due to the interruption of signals to and from the spinal cord. Most of these clients have constipation. Bowel incontinence may also occur, so the nurse should encourage the increase in fluid as with bladder dysfunction. They should be taught to establish a routine for bowel elimination, and nurses must educate the clients to have a bowel movement every 2 to 3 days, so they need to increase their fiber intake. For decreased visual acuity and cognition, the goal is to maintain adequate visual acuity and cognition to function independently. Areas affected include attention, memory, problem solving, auditory reasoning, handling distractions, and visual perception. For impaired cognition, you want to assist with orientation by using a single-day calendar. Give or encourage the patient to use written lists or recorded messages. To maintain an organized environment and encourage the patient to keep frequently used items in familiar places. An eye patch that is alternated from eye to eye every few hours usually relieves diplopia. For peripheral visual deficits, teach scanning techniques by having the patient move the head from side to side. Neuropsychologists, occupational therapists, and speech-language pathologists can evaluate and treat cognitive. Compensatory activities help strengthen functions that are not working well. Recording lists or notes and using checklists and alarms help increase memory. Decreasing distraction, taking breaks, and only performing one task at a time is also helpful. And the nurse can suggest that clients use a calendar for an event that needs to be remembered, as well as a central area for all needed information. Risk factors. MS has unknown etiology. It's possible hereditary genetic factors play the largest role in the disease development, and having a first-degree relative, parent, or sibling increases the person's risk for developing MS. MS may also be viral. Complications that can occur because of MS. Infection due to their impaired immunity. So we want to teach these patients to avoid large crowds and anyone who is sick. Remind them to wash their hands frequently and seek evaluation at the first signs and symptoms of infection. Falls, UTI, constipation, pressure injury, contractures, pneumonia, and osteoporosis are also complications that can occur. Mental health challenges, including depression and anxiety in MS, is linked with increased pain levels, increased risk of alcohol use disorder, and decreased social interaction. Depression and anxiety can exacerbate thoughts of suicide and should be addressed immediately. So for patient teaching and management, patients usually live independently with their disease, but some may need assistance. So to help the patient maintain maximum strength, function, and independence, you need a continuity of care by an interprofessional team in the rehabilitation area or in the home setting. This approach may include the services of neurologists, nurses, physicians, ophthalmologists, speech therapists, physical therapists, occupational therapists, social workers, psychiatrists, urologists, and gastroenterologists. MS affects the entire family. Because of the unpredictability and uncertainty of the course of the disease, you want to assess coping strategies of family members or other caregivers and help them identify support systems that can assist them as they live with the patient. Physical wellness is important for clients who have MS. Consuming a healthy diet, refraining from smoking, preventative care, exercise, and management of other medical conditions can positively influence the disease progression and the client's lifespan. Care should be taken to remain up to date on vaccinations and participate in preventative health activities. There's not a definitive diet proven to change the disease course of MS. However, a balanced diet can maintain a healthy weight, and it's associated with decreased disease activity and MS-related disability by decreasing cardiovascular risk factors. Clients who have MS see a temporary worsening of manifestations in hot or humid weather or when they run a fever. So sunbathing, hot showers or baths, and exercise can cause the same effects. These changes are temporary and resolve when the client's temperature cools down. Cold weather can also cause worsening manifestations. Clients who have MS should avoid extremes of temperature. Exercise is very important. It helps with increasing energy and decreasing depression, but they don't want to do it as it can cause issues. Swimming and water aerobics are good. Urinary complications, they need to ensure easy access, clutter-free skin care, self-catheter retention, and be sure they're drinking 1 to 2 fluids per day to prevent any urinary complications. For bowel complications, such as diarrhea or constipation, they should increase their fiber, use a stool softener, and make sure they're maintaining skin care. And that concludes this lecture. Thank you.